Hello, I'm Helen Fu, the host of this TV show, Health Factor with Helen Fu. I'm also a certified nutritionist, Chinese herbalist, and a specialist in weight loss, diabetes, cancer, diet, and nutrition. An estimated 19 million American adults are living with major depression. According to medical research, 1 in 5 children in this country has diagnosable mental, emotional, or behavioral disorders. Many more people are suffering from other mental issues, such as anxiety, insomnia, or addiction. Have you ever wondered what causes all these problems? What can we do to prevent or even reverse such conditions without medications? Today, I'm going to take you on an exciting journey to uncover the truth about mind and body connection. I'm very excited that we have a special guest here. She's a clinical psychologist, psychotherapist, author, researcher, wife, mother of 3, and a good friend of mine, Dr. Caldwell-Andrews. Welcome to the show, Alison.
Thank you. Thank you so much. I'm so glad to be here.
Well, we've met not long ago, but instantly I felt connected to you because we both have this path we want to explore, and we all want to have, help people. We have this passion. So I want you to tell us a little bit about your background. What helped you to come on to this background or the path?
Okay, and the path we're talking about is really the path of being a healer.
Yes.
And your connection to me, we find each other as healers, like we find many people who have that passion to help others. I think it started, it always starts a long time ago. And one of the things, I think of several points in the past. One of them was when I read this book called The Family Crucible, where what it talked about was systems theory. Mm-hmm. And this idea that it wasn't just one cause, like a designated, identified patient that was the problem. It was the whole system that was the problem. And then I ended up at the Yale School of Medicine doing a postdoc in mind-body medicine. And even as an academic, I would notice that, here we are, we're doing research, we're doing science, and there's a lot of limiting factors and a lot of limitations in terms of how we're allowed to think, what we're allowed to publish, those sorts of things. And it wasn't really until I started practicing full-time that I really got it, really saw in front of my face every day this evidence of the mind-body connection and this understanding that people don't get better when they ignore their health. And so I can do everything I can to help them emotionally. And it doesn't work until they take advantage of that mind-body connection.
So I understand when we were talking that you had some personal experiences that kind of helped you to start to look for what is true health and about this mind-body connection. Could you tell us a little bit more about that?
I'd love to, yeah. I think we all have these personal experiences that bring into our lives that extra sense of passion and that sense of this is why I'm doing it. Because if we're alert and observe and we're awake and notice things, then you can't help but see what is it that's working. And so I think we're all scientists in some way because we are observing our lives. And so one of the things I noticed was I had a sinus infection that wouldn't go away. And so I went back to my doctor and, it was time for even bigger guns. We'll pull out the big antibiotics. And I thought, well, I know every time I take an antibiotic, I'm a mess for like a month or two. Yes. And it feels horrible. And so then I started doing something dangerous and reading other alternative sources of information. And I thought, well, I'm going to try this. And I found a place that talked about using a neti pot and using hydrogen peroxide. And that hurts. But nothing hurts like a sinus infection.
Oh, absolutely.
It's awful.
Yes.
Like when it's really bad. I remember this one where my husband drove me to the doctor, and every bump on the road, I would start crying.
Oh.
And the nurse said, "How are you feeling?" And I just started crying because it hurts so much. And so I'm like, a little hydrogen peroxide, nothing. You know, I'll happily take that. And so I did that. 24 hours later, I was completely fine. And I thought, I'm so glad I skipped over that last big gun, and I didn't need that. It wasn't doing anything. And that was like the real big turn. And then I started noticing things. I have this chronic cough, and I went to like 4 or 5 different doctors, and I got 4 or 5 different diagnoses and 4 or 5 different treatments from all of them, none of which worked. And so I turned to other alternatives, and that worked. Not 100%, but pretty well. And I started looking at other ideas. Why do we end up with these problems that are seemingly unfixable?
Yeah, that's very interesting because during my practice with clients, I've seen a lot of people with sinus infections or with allergies or coughing or just respiratory problems. And in Chinese medicine, we know it's always related with emotional issues. Sadness and grief actually are stored in our lungs and colon. So lungs and colon, interestingly, it's the same system. It's your immune system.
Right.
And so when people have unresolved sadness or grief, then they always have problems with respiratory problems, with sinus infection, with allergies, and also with digestive problems.
Right.
Yeah. So what kind of trainings do you need in order to do what you are doing now as a clinical psychologist and psychotherapist?
What kind of training? It depends on what you want to do. You know, if you want to do therapy, there are lots of ways to get there to where you can do therapy. You don't have to get a PhD. If you want to be an herbalist, there are lots of ways to be an herbalist. You know, if you want to be a healer, there are lots of ways to be a healer. If you want to learn how to be inspiring, there are lots of ways to do that. There's not really one path that I would recommend. I think follow your heart and just kind of do what makes sense for your life so that you can accomplish the goals that you have in mind. And so if you keep your eye on your goals and find ways to get there, you'll get there.
It's very interesting when we were talking that we took different starting points. I started with Chinese herbs, with Chinese medicine, acupuncture, and you started with the pretty much the trainings in the States about
straight up science.
Yeah, science and all of this. But then we somehow merged our path, and now we found this point that we all need to go forward. That is the mind, body, and emotional connection.
Right.
Yeah. And so tell us a little bit more about what kind of background do you have, and what kind of work did you do?
Okay.
Yeah.
Well, I was raised up, you could think, in a very empirically oriented school. So when I was in graduate school, it was very much science-based, and everything we learned was based in science, and we learned how to look at methodology. And so one of the things that I really liked, because I liked playing logic games and all those sorts of things, was this idea of scientific, rigorous methodology. How do you create a study? How do you manipulate variables? What do you need to control? And so when you read articles, the real scientific articles from the journals, what you do is you look at the method section, and a lot of people want to skip that section because it's full of a lot of technical information, and they're like, "No, ouch, that hurts." And we just skip to what's the outcome? Just give it to me in a couple sentences. So let me read the abstract or something. But what we did was we really looked at what was there in the methods, and one of the things that I remember doing was we had a qualifying exam. At the very end of your graduate studies, you take the big exam. And the one for methodology was my favorite because I'm a nerd. And so what we had was we were given this article to kind of take apart. And so I'm shredding it. I'm just looking at all these problems. And I'm thinking to myself, I actually mentioned this in my introduction to my book, this has got to be an awful article. And I realized later, this article was probably published in a pretty good journal. And I asked the professor, and he said, yeah, it was published in one of the top journals out there. And he told me what journal it was, and certainly it's in the top 3 of all the, 90% rejection rate. And so I'm thinking, okay, so we're getting this information, and most people don't go to the research methods section. Most people don't look at what is going on in the science. They just want the little blip. And so we have all kinds of things where people are reporting results that don't make any sense. Like there's an article recently that said fish oil, take omega-3 fatty acids are dangerous. They'll give you prostate cancer. And
depending on the quality of the omega-3, whether they're contaminated with mercury or PCB or
right,
the
and
other
that would
stuff,
definitely play a role. Except the problem with this was the people in the study weren't even taking omega-3 fatty acid supplements, and so this is a great example of how you have some scientific information that gets interpreted by the scientists, interpreted by the reporters, interpreted by the doctor. And so the idea is that we all interpret things through a filter. And whatever you're interested in, that's what you tend to filter toward. And what I really started to see is that, science, the truth is out there. You and I came on different paths to what we feel is the truth about the mind-body connection. That's paramount. It's critical.
Yeah, absolutely. And so I do want to talk about the book, The Fix.
Right.
Newly published, and I've been reading the book. I just got it last week, so I've been reading this book, and I'm fascinated just by the way you wrote the book. Of course, you're a scientist, a researcher, so you know a lot of science, but you make it so simple to read for just laymen and for people who don't want to understand about all these scientific terminologies. And I especially like the chapter where you talked about this soldier analogy.
Right.
You make it so easy to understand about inflammation and what's going on in the body and what we need to do the body to fight over the infection or inflammation. So could you kind of tell us a little bit about how you started to write this book and what approach and what you want to accomplish with the book?
Well, I have all these ideas, and sometimes I lay in bed and I think about writing books, or I think about designing research studies and things like that. I get really excited about it. And I really wanted to write down a message to help inspire people so they could change. Because I see a lot of hopeless, discouraged people who just don't know why they're hopeless and discouraged. And they don't know that there are little things they can do to create change. And so they stop, they quit, they've given up. And I wanted them to have access to a way out of that discouragement. But I wanted it to be accessible to anyone who just wanted to read it without having to have a glossary of scientific terms. And so I went through it a couple times trying to simplify it and take out unnecessary scientific verbiage. You don't need to know, they don't need to know this, they don't need to know, the important thing was distilled into what people could understand without having to feel like they needed to go back to school. And one of the things I notice in a lot of scientific journals is it takes a long time to read some of the articles because people lose track that they're speaking to like 4 people in the world who know what they're talking about. And there's really nobody else, and the rest of us have to kind of laboriously go through this and figure out, it's so convoluted. What are they even saying? I didn't want that. I wanted to be inspiring. I wanted to be accessible. I wanted people to know there is a way out. You can change.
Well, that's great. And in the book, throughout the whole book, actually, you talked again and again about these 3-legged stools.
Right.
And isn't that boring, or it's not going to be boring? Or tell us why you keep on repeating this.
The 3-legged stool idea. The 3-legged stool is all about, there are 3 things that underlie your health. And some people will say, well, there's 5 or there's 7. But it's those basics. They're still the basics. They're the same basics everywhere. What are you eating? How are you sleeping? Are you exercising? And of course, the mental health aspect, to me, permeates all of that. And so I don't separate it out. Some people do. And so the 3-legged stool is eating, sleeping, exercising. If you can stand on those 3 legs, you're on a firm foundation, and you can do what you need. You can accomplish your goals. You can feel good. If you're not, you can't feel good very much. You have to prop yourself artificially up. You're drinking a lot of Diet Coke or whatever it is. You're not feeling very good. So the 3-legged stool is throughout the entire book because it underlies everything. And it underlies inflammation, which is also throughout the whole book. And you see it in IBS, of course, but you also see it in depression. And that's one of the new cutting-edge ideas that most psychologists, most mental health workers out there right now aren't aware that this is even in the literature, because what happens is things go in the literature, they're scientifically explored, and then it takes about 20 years
I know,
to get
it takes,
to practice.
Yeah, a couple of decades.
Right, it's
yeah,
ridiculous.
For people to put in practice.
And so this idea that depression is inflammation related is kind of cutting edge and shocking to people, and they think, what? But it makes sense when you understand what's going on.
Inflammation is the root causes of a lot of problems,
Right.
including Parkinson's disease. And so
Right.
now scientists are calling it type 3 diabetes.
Right.
Yeah. And so that's what I've been dealing with a lot of my clients. They come in with a lot of different symptoms, but it all come to the root causes, as you just mentioned, of course. Diet and nutrition is huge.
Right.
And so what do you do with your kids? I know you're a mother of 3. And so how do you encourage them to eat healthy, and how to make this fun and also tasty?
Well, we don't live a life where we never have sugar in the house. Occasionally we do some things. But what we do have is a lot of really tasty food and a lot of experience with food. And so I brainwash my kids, shamelessly brainwash them. And I'll say, I've got an 11-year-old son now who is telling people, oh, I love garlic. Garlic and onions together, so good. Yeah, that's the result of my brainwashing. Because when he was little,
garlic?
Well, we would cook together, and I would say, smell this. Doesn't this smell good? And he would say, oh, and it is. It's so yummy. Yeah. Or we garden together. And so we have a big garden, and I involve my kids in every aspect of it. From when they were little, they had a little place they could plant, and now they're bigger, and they can, you can see my daughter, and they love the garden. And then what happens is when they're involved in the harvest, they're really experimental. I had a picture I didn't bring of my daughter eating the flowers from the broccoli.
Oh, eating the flowers.
So broccoli flowers, and they're eating these flowers right off the plant. My son will go to the garden and graze. Like, he literally will grab the kale plants and just eat off the kale plants. And here they've got my daughter eating the this little cut up greens.
Yeah, is that like a spinach or kale? It looks like kale, probably.
It's a whole mixture of spinach, kale, greens. We called it macéré just for fun, because you're macerating the leaves, and so we put a little dressing on there. And I love her excitement. She's got such verve.
I know. I mean, how many kids would feel that excited to eat some green vegetables?
Right. You make it fun, and then you model it, and you don't have this idea of, oh, I hope you eat your vegetables. It's just sort of like, well, here you go, or you can starve. And we don't have anything else in the cupboard. So if you think you're going to go find something in the cupboard, good luck with that, because there's more vegetables where that came from. That's pretty much, or you get lentils, there's not a lot of fun, typical foods in our cupboard. We just don't have them. Yeah. And they learn to love and enjoy and find a lot of satisfaction in things like lentil burgers, or black bean burgers, or those sorts of things. They just like them.
I think that's the key, really, to involve the kids with planting and gardening and cooking together, and then they would enjoy the results much better, right?
Right. And then I think about where they're coming from. They've grown up eating vegetables, and that's providing this foundation for growth in their bodies. And when they're 40 and 70 years old, that will still have been a great start for them. And I look at some of my clients who don't have those kinds of advantages, and who, they struggle because their diet consists of, white bread and Diet Coke. And I'm thinking, well, of course you feel horrible. Fix your diet. I can't even help you with the psychological stuff, because you feel so rotten because of what you're eating.
Well, absolutely. And it saddens me sometimes to look at some of the kids and what they're eating. And I've seen a kid, actually a boy, who consistently has a Coke and a Pop-Tart for breakfast, just eating that while waiting for the school bus. And I'm thinking, no wonder the poor kid can't focus.
Right, no wonder he can't focus.
Yeah, so then their school performance, of course, and
and their attention
problems.
And their aggression levels, it's all connected. And it's back again to that same mind-body connection. It's all completely connected. There's psychological, academics, friendship, relationships, your ability to manage your feelings, to tolerate having feelings, all of it is connected.
Yeah, and then out of the three-legged stool, another component is also huge, sleep. I can't emphasize enough how big a deal that is to have enough sleep. So could you share some insight about that?
Yeah, I can tell you. You know, it's funny. People will come in to see me and they'll say, well, I have, you know, this trouble, anxiety or depression or panic or whatever. And then I'll say, okay, so now your sleep is probably not good. And they're like, how did you know? Like, well, and I'm sure you're having trouble with your stomach. And they're like, how did you know? Well, you know, it's all together. It's all connected.
Absolutely.
Everybody is having the same trouble. The sleep, the stomach problem, and the anxiety and the depression, and now the panic, and you can't tolerate your you can't, you know, it's all connected. Sleep is a huge deal. A lot of times people get more sleep and a lot of their symptoms just go away because they're sleeping better. And they'll say, in fact, I had a client this week who said to me, you know, and she's in her 20s. And so a lot of this happens when you're in your 20s, you don't really get it.
Yeah,
because
when
your
you're
body,
young,
your body
you feel
can,
like you're invincible,
right.
You can abuse it.
and it doesn't fall apart as quickly as it does when you're older. And she said, I'm starting to really get this. I've started really working on my sleep, and it's like I can think again.
Oh, yes.
And I'm thinking, and all this time you thought that you couldn't think because there's something wrong with you. And so what happens is people start saying, oh, there's something wrong with me. I'm a bad person. I'm a stupid person. I'm you know, whatever it is. They make some understanding about themselves. It's not true. It's just that they needed to sleep. You know, get enough sleep.
Simple, yes, and exercise, of course. Yeah, it's always a huge deal to exercise.
Yeah, exercise is so critical, and there's so much scientific evidence that supports the use of exercise that I kind of think it's almost malpractice to not talk about exercise as a treatment. Yes,
I agree. So in my practice, I always try to design a program, you know, involving all the different components: diet, nutrition, exercise, sleep, de-stress. Right. And so in your last chapter of the book, you mentioned the 3 things. Could you elaborate a little bit more about these 3 things?
Sure. The last 3 chapters or so really are focused on how to help yourself with behaviors. And so again, I'm wanting this to be an inspiring book to help people change, who feel discouraged, who feel like it's all too much. I don't know, I'm hearing 20 different people saying 20 different things. What is the thing that I need to do? Instead of just giving up, come here and find a fix. You know, get on that 3-legged stool. And here are some behavioral helps. So this has been my long-term interest, is how behaviors and the 3-legged stool all interact to create a really total health, mind-body total health. And so we talk about things like self-compassion. Self-compassion is a way of looking at your behavior and finding ways to attain your goals without killing yourself with guilt. That's useless. Guilt will only end up, you know, leave you on the side of the road and people have to drag you along. It's not very helpful. Or we look at something I call act yourself into change. A lot of times people try and use willpower, or they say, you should do this, I must. And that doesn't work. But then we're like, oh, it didn't work, you better do more. That's the American way. Do it faster and harder. And then they're like, should, and it doesn't work either. So I talk about acting yourself into change and just being bold and doing things even though you don't feel like them. And the primary principle here that I want to share, like, with the world, is that if you do the behavior, then you start feeling like doing the behavior. If you wait till you feel like doing the behavior first before you do the behavior, you're not going to really do the behavior. So you act yourself into change, and that's critical. And then another way to kind of look at what's going on in your mind and your interpretation is to look out loud. And so I use that as a way of saying, let's just talk about what's going on in your head when you look out loud and you say, oh, that's what I was doing. I'm looking out loud at this. And then other people can give you some feedback and say, that's really not true. That's not how the world works. You know, you created this in your mind, and it's limiting you. And now you're not exercising because of this idea about your mother. What's going on with that? You know, so look out loud.
Yeah, that's interesting. So where can people find the book if they want to? I highly encourage people to read this book. Yeah. So where can they find it?
They can find it on Amazon.
Okay.
It's easy on Amazon.
Okay. How about the other bookstores or any bookstores will carry it?
Amazon has some arrangements with other bookstores that may or may not carry it. I'm not sure. It's fairly recently published.
Yes.
So every time I check Amazon, the price just keeps going down, which is great.
Well, that's good. Yeah. Well, so what's your final thought for the audience? And if people can walk away with one message from today's show, what do you want them to remember?
I think I'd like them to remember you can do this, that your discouragement makes sense, that there are reasons for you to be where you are right now, and there are things that you can do that will indeed help. You don't have to give up. There are principles out there that you may just not know about, and so don't give up.
Well, that's absolutely just incredible, and that's great information. And so if people want to get more information about your practice, or how do they contact you?
They can call me, they can text me, they can look at my website. Those are 3 great ways to connect with me. Texting, I love texting now.
All right, so you do have a website that people can go
right.
and check out more
Caldwell-Andrews.com.
information. All right.
Right.
So, well, I want to thank you so much for coming to our show, Alison, to share with us your experience, knowledge, and insight about this mind-body connection, so
You're
that we
so
all
welcome.
can
Thank
feel, better, and to help ourselves emotionally and physically.
Thank you.
Well, thank you
so
so much. And I hope that I'll see you again someday, and so we can talk more about our
you will
collaboration.
See me. Right.
Absolutely.
You will.
Well, great.
Great.
So I hope that you can find the time to read this book, The Fix. It's a great book, and I certainly enjoyed reading this book. Scientists have found that the mind and body connection is paramount. It's huge, and I believe we are actually right in the edge of cultural shift from this biomedical to a more integrative approach. So please stay healthy, mentally, emotionally, and physically. See you next time. Bye-bye.